There's a crisis playing out inside clinics and hospitals.
Our public health care scenario has basically become a crime scene.
A tragedy is taking shape behind school gates.
We're no longer just trimming the fat, we are right at the bone.
Severe budget cuts are pushing professionals on the front line to despair.
The scale of the cuts were just simply too great for provinces to absorb.
It is still very raw. I am still angry.
A workforce of over 1 million government employees is calling for a decent wage, while service delivery is stumbling with no relief in sight. Amy Venter has spent almost half her life teaching in the Western Cape. This year, she's been on contract as a natural science teacher in a township school.
There's a massive need for teachers trained properly in teaching natural sciences and to teach learners how to think critically. And without someone to lead them, they're not going to just naturally develop it.
But she's received a letter to say that from January, she will no longer have a job.
I was in utter disbelief. I literally started crying. I thought science teachers would always have a job. Now suddenly I'm sitting in a position where that certainty has been taken away from me.
Venter is one of many teachers in the Western Cape whose posts have been cut. She's spoken out. #I am one of the 2,400.
I wanted to put a face to the teachers, to show that we are people, we have families, we have a passion for education. We're not just a number.
But decision makers say they are forced to treat thousands of public sector professionals as numbers, as they try to balance the books. National government allocates money annually to provinces to spend on service delivery. Each province then prioritizes spending in its own budgets. But last year, the state negotiated a national wage increase with public servants, which exceeded expectations, forcing the provinces to dramatically downsize spending plans. The fact is, public service unions negotiated a higher wage increase than the state can afford. And now the provinces are paying for it.
The situation is, in fact, probably even more severe than many people realize. Our province is a province where we expect net enrollment to increase in 2025 by anything up to 14,000 learners.
You're expecting more learners, but you have fewer teachers.
Correct. 14,000 additional learners is roughly the equivalent of 14 additional schools in one school year. So the pressure in the Western Cape is enormous.
David Mania is the MEC for Education. His headache is a 3.8 billion rand hole in the school's budget over 3 years. Across all government departments, the Western Cape is a case study in crisis management. By speaking out, it's the canary in the coal mine, as other provincial administrations are also in trouble.
It is a shared problem. Other provinces are starting to cut spending, for example, on school nutrition, on learner transport, on transfers to schools. Many provinces have stopped paying suppliers, stopped paying municipalities, and some provinces are set to dramatically overspend in this financial year.
Austerity is hitting very hard as National Treasury pleads poverty. It's difficult to get a clear idea of how each provincial administration is adapting to these budget cuts. It's a mixed picture of pinching here, scraping there, or slicing services to the bone, and sometimes losing them altogether. But the strain isn't limited to education. Health is feeling the squeeze too. The ophthalmology department at 𝗀𝗁𝗃𝗃 Hospital is now understaffed. Pioneering eye surgeon Professor 𝗀𝗵𝗶𝘀 resigned last year, as part of a succession plan to give a junior a chance to skill up in his speciality. But the hospital made a saving instead.
There was only one post really in the entire country for the eye cancer specialist. Since freezing the post, there is no one who can see eye cancer patients actually.
Carte Blanche first met Professor 𝗀𝗧𝗵𝗶𝘀 in 2018, when he was part of a team developing innovative methods in a highly specialized surgery. Despite resigning to move into the private sector, he volunteers to assist less experienced doctors who are handling an increased workload.
On the days that I come to clinic, there are over 40 patients waiting to be seen by me. They don't have a diagnosis, they don't have a treatment plan. So spending 3 entire whole days at the government hospital without even knowing what's wrong with them and what the plan is for them.
What's been your experience with the budget cuts in the health sector?
Sorry.
Is it difficult to talk about?
The frustration is that it's not something that's in my control. Yet I'm the one who has to explain to the patients what the situation is.
The belt tightening impacts on Professor 𝗀𝗧𝗵𝗶𝘀's former patients. Capetonian 𝗀𝗶𝗵𝗀 has a chronic eye condition.
My right cornea is hanging on a string. If I don't get treatment, I can be blind.
Mackenzie has waited for almost a year for a critical operation.
They don't have the specialists available. And I feel the MEC of Health with the government has failed the patients of 𝗀𝗁𝗃𝗃. I've experienced a drop in the quality.
South Africa has world-class operating theatres, the iconic 𝗀𝗁𝗃𝗃 Hospital being case in point. But this is precisely where the impact of the budget cuts is being felt. Freezing posts has led to a reduced number of staffed operating theatres, resulting in 40 fewer surgeries weekly compared to last year. Over 4,500 people are currently waiting for surgery at 𝗀𝗁𝗃𝗃 Hospital, of which 10% are cancer patients.
I coined the term theatre load shedding. Because we've lost anaesthetists whose posts haven't been filled, they've been frozen. Without them, we cannot perform surgeries because you can't give a general anaesthetic. We're also short of nursing staff.
The health department said this week that they are in the process of filling Professor 𝗀𝗧𝗵𝗶𝘀's post in a campaign to rebuild lost capacity.
We have had to close some theatres across the province as a result of the budget cuts.
But the MEC for Health, 𝗀𝗁𝗁𝗃𝗃, says the quality of healthcare is not compromised, just the quantity.
I mean, you can't have a half-staffed theatre. So we're making sure that the theatres that are operational are fully staffed and have all the equipment that they need for those procedures for patient safety. We're now up to a backlog of about 83,000 surgeries.
Are those life-threatening surgeries?
It ranges from the very minor to the more urgent.
The financial crisis, exacerbated by the 2023 wage agreement, has disrupted the best-laid plans of provincial departments across the country.
Sometime in June 2023, I remember the day where, as a result of the expected budget deficit and the fiscal uncertainty, I cancelled 11 school bills in a day.
Traditionally, wage deals were fully funded, and that's what made that particular financial year significant, in that the funding didn't following the negotiation of the wage deal.
How much was the wage bill for the health department?
So we were looking at a pressure of just over R1 billion, and we got 70% of that, so we're looking at about 300 million, yeah.
The
So
shortfall.
Big numbers, yeah.
In other words, the provincial department feels its hands have been tied by a spending decision taken at national level. In Parliament, opposition politician Dr. 𝗀𝗁𝗃𝗃𝗃 is asking tough questions about the impact on the health system.
Basically, cutting budgets to a struggling system like we have is violating the constitutional rights of patients.
Dr. 𝗀𝗏𝗏𝗀𝗏 says nothing will change until all public servants and politicians are compelled to use state healthcare rather than private.
We can't be talking about the wage bill when the president has the temerity to go and double the size of cabinet. You know, for ordinary people that are essential, that make an impact on ordinary lives, that's where we cut. But for things that are grandiose political agreements, we will spend lavishly without any restraint. It doesn't make sense.
And to perform the functions of my office conscientiously and to the best of my ability.
One of the newcomers to cabinet is the Minister of Basic Education. Once in opposition, 𝗀𝗵𝗀𝗀𝗶 is now grappling with a massive budget crisis, just months into the job.
The figure that gives me chills, and it's not a final figure, but out of about almost 118 billion rand shortfall in the next 3 years if the budget remains the same.
Ministers are lobbying the Treasury for more cash for service delivery. So there's much anticipation this week as the Finance Minister prepares to table his spending plan for the next 3 years.
Hello, how are you?
Well, thank you, Minister.
𝗀𝗏𝗏𝗀𝗏 has organized meetings between provincial education MECs and Treasury to plead the case for education. Each province is managing their budget shortfalls in their own way, but this is a united call for help.
My plea to Treasury is to say we need immediate buffering of the budget cuts now.
Treasury told us they regularly advise provinces on how best to allocate their limited money. All eyes will be on the Finance Minister this week to see what he concedes when he presents his medium-term budget in Parliament. How will he balance the needs of the people against the pay of the public servants?
My view is education, healthcare, police, service delivery, those are the things that are critical to any nation. So we need to have a whole review of government spending so that we can actually put our money where our mouth is. We can't say these are our priorities, but then we're putting money elsewhere.
But political talk seems cheap to Venter and Professor Mustak, both of whom have given their best years to public service to build the country for generations to come.
The wait times are what's longer. So explain that to a patient who's got eye cancer or any cancer. They can lose their life.
I want other teachers to raise their voices. I want them to speak up about what is right and what is wrong. I want them to try to make a difference.